All regional and directional terms are based on anatomical position, which is defined as standing erect with arms at the sides, palms facing forward or anteriorly, and feet shoulder width apart. The terms superior and inferior, superior can also be called cranial, which means pertaining to the head. Inferior can also be referred to as caudal, which means tailward. Those terms, those specific directional terms, can only be used on the axial portion of your body. The axial portion of your body is located from here upward all the way to and including the head and neck. Okay, that's all axial. Arms and legs are appendicular because they are appendages. I only say my nose is superior to my mouth, as opposed to saying my elbow is superior to my hand. That statement is incorrect. There are different terms that we use for appendages. Again, superior and inferior, or cranial and caudal, only used with the axial portion of the body. I'm trying to highlight that for you. The term ventral or anterior refers to anything in front of the body. The word ventral actually means bellyward. So on an animal, such as a dog, ventral is not always anterior. However, on bipedal organisms, such as human beings, ventral and anterior are interchangeable terms. The term dorsal or posterior means towards the back of the body. Notice I said posterior as opposed to posterior. I am sitting on my posterior. The term medial refers to something that is towards the midline of the body. Lateral means away from the midline, going out to the sides. My shoulder is lateral to my sternum. My ears are lateral to my nose. Intermediate means between a medial and a lateral structure. My clavicle, which is my collarbone, is intermediate to my shoulder and my sternum. Proximal and distal are the terms that are used for appendages. You'll recall I stated we don't say the hand is inferior to the elbow. We only use inferior and superior, or caudal and cranial respectively, with the axial portion of the body. For appendages, which are arms and legs and make up the appendicular portion of the body, we use the terms proximal, meaning closer to the point of origin, and distal, meaning farther from the point of origin. Basically, the point of origin is where the appendages attach to the body. Proximal means that there is proximity, closeness. I can say my wrist is proximal to my fingers, because if I compare the position of my wrist here, it's proximal to the point of origin on my body up here, in comparison to my fingers, which are over here. My wrist is proximal to my fingers. My fingers are distal to my wrist. My feet are distal to my knees. They're farther away from the point of origin in comparison to my knee. My knee is proximal to my feet. Why is it proximal? It's closer to the point of origin than my feet. I'm comparing them. Superficial means toward or at the surface of the body. My hair is superficial to my skin. My skin is superficial to my muscles. Deep means away from the surface of the body towards the internal portion of the body. My heart is deep to my sternum. This slide is also on the original PowerPoint presentation that you can find and print out to use to practice on your own. This particular PowerPoint slide is merely a list of things you should either be able to define or identify. This particular slide shows a picture of body surface landmarks, both anteriorly and posteriorly. You'll notice that some of the words are in bold, such as on the left side, you see the word cephalic at the top. Cephalic means pertaining to the head. Underneath that word, you'll notice several other words that are more specific for the head. You need to know every single term on this picture, both front and back, not only for lecture, but also for lab. This is a very good thing to study. Here we have a blank picture. You can also print this out on the other PowerPoint attachment that doesn't have the video recordings and use this for practice. Sectional planes are sometimes referred to as planes of dissection because they're utilized to view internal organs from different perspectives with different types of imaging processes, such as a CT or MRI. The transverse plane is used to divide the body into superior and inferior sections. The transverse plane is sometimes known as a horizontal plane because it goes along the horizon. Transverse or horizontal planes don't just go through the midline as is shown in this picture. They can be moved to go through any portion of the body along that plane. A frontal plane is used to divide the body into anterior and posterior portions. The frontal plane is sometimes also referred to as a coronal plane. If you think about a crown on the head, dividing anterior and posterior, cutting right down through that way. Frontal planes could also be moved into different portions. I could have a section that goes here or here or here. So that's a frontal plane of dissection. I'm still getting that anterior to posterior, but I can move it according to the needs of what I'm trying to see. A sagittal plane of dissection divides the body into right and left sides. When the sagittal plane of dissection runs right through the midline, it's referred to as mid-sagittal. Okay, if it's right through the midline, mid-sagittal. If it's off to the side, I'm still in this same plane. Trying not to angle that. It's referred to as parasagittal. So I could do mid-sagittal, directly through the plane of dissection, or parasagittal, off to the side. Mid-sagittal is much more specific than just sagittal. This is also referred to as a median plane of dissection or sectional plane, median, not to be confused with medial, which means towards the midline. The abdominopelvic cavity can be broken down into 4 quadrants. Physicians often use these 4 quadrants to identify different things that may be going on with a patient. You'll notice there is a right upper quadrant on the patient's right side, a right lower quadrant, a left upper quadrant, and a left lower quadrant. It's common for physicians to use these quadrants as landmarks for examining a patient. First, they'll view the quadrants, looking for swelling, redness, discoloration, and then they'll go in with a stethoscope and listen at various places within the quadrants, kind of snaking their way around with their stethoscope as they listen in each of the 4 quadrants. And as they do that, or after they do that, they'll do light palpation in each of the 4 quadrants in a similar pattern to where they were listening. And then they'll do deep palpation where they press in with their fingers approximately 1.5 to 2 inches, again feeling for things like pain, tenderness, swelling, heat. And if we connect the dots, you'll see that snaking motion as they examine those 4 quadrants. This is a little difficult to do with my finger on the mouse pad, but you get the idea of snaking through. If a patient comes in with pain in the right upper quadrant, that might indicate a problem with the gallbladder or liver. Pain in the left upper quadrant might indicate a problem with the stomach or pancreas or spleen. Pain in the right lower quadrant may be indicative of appendicitis if it is located 2 inches to the right and 2 inches inferiorly from the umbilicus. That's a point known as McBurney's point. And again, that might indicate appendicitis. If we look at the picture on the left, you'll see 9 regions. This is something that is more commonly used by anatomists because it's much more specific. With the 9 regions, the very center is the umbilical region. And you'll notice this looks very similar to a tic-tac-toe board. So the center is the umbilical region. If we want to learn these regions, you can do this on yourself. If you put your index finger in your belly button, your umbilicus, and reach up with your thumb is now in the epigastric region, and your index finger is in the umbilical region. If you switch places, put your thumb in your belly button and move your finger downward as far as it'll comfortably go, your index finger is now in the hypogastric region. On either side, where your torso meets your thigh, that would be the right and left inguinal or iliac regions. Come back up to the umbilicus and take your hands on either side. Now you are at the right and left lumbar regions. If we go back to the umbilicus, move your thumb upward, and then take your hands where your thumb is and go out, you'll feel the cartilage of your ribs, which you can see on this picture. Those are the right and left hypochondriac regions, right over here. Here's the right, here's the left. And I left this picture up because you can more easily see the cartilage of the ribs on this picture. Hypo means under or below, chondro means cartilage. That's how these terms got their names, right and left hypochondriac regions. Here's another picture of the abdominopelvic regions. Again, there are two terms for the iliac or inguinal region. Here we have in parentheses hypogastric or pubic region. Pubic is not very common. They usually use the term hypogastric. Here's a slide that you could print out on your own. Again, you'd find it in the attached slides for the other PowerPoint presentation that does not have this video recording. You can print that out and practice. Body cavities are spaces where organs reside. They help to protect against shock, and they also allow the internal organs to change shape and move as necessary. There are two main divisions of body cavities. In the posterior or dorsal aspect of our body, we have a dorsal body cavity, which is lined with special membranes that are called meninges. The dorsal body cavity contains the brain and the spinal cord. There are two divisions of the dorsal body cavity, which include the cranial cavity. The cranial cavity houses the brain, and the vertebral cavity, which houses the spinal cord. The other main division of body cavities is the ventral body cavity. If you think about it, we've got more organs anteriorly than we do posteriorly. The picture on the left is a lateral view of the body cavities. We can see on a lateral view the dorsal body cavity with the cranial cavity and the vertebral cavity. On the right side, which is an anterior to posterior view, we can also see the cranial cavity and a portion of the vertebral cavity. Moving to the ventral body cavity, on the lateral view, we see that the ventral body cavity is made up of two main divisions. One of those main divisions is the thoracic cavity. The thoracic cavity is further divided into smaller portions. On the right side of the picture, you can see that there are two purple-colored pleural cavities. Pleural means pertaining to the lungs. You can see there is a pericardial cavity in turquoise. This is the pericardial cavity. And then you can see that the pericardial cavity is located within the mediastinum. The mediastinum is not a cavity. It is an area. Please make sure you understand that. So we have a right and left pleural cavity, a pericardial cavity, and then the area between the lungs is the mediastinum. The mediastinum, by the way, is an area where you will find the heart, the trachea, the thymus, and the esophagus. Dividing the ventral body cavity is a structure known as the diaphragm. The diaphragm divides the thoracic cavity from the cavity below, which collectively is known as the abdominopelvic, and here is that word just above my picture in the video, abdominopelvic cavity. The abdominopelvic cavity is further broken down into an abdominal cavity and a pelvic cavity. You're going to want to know the different organs that you can find in these cavities. The abdominopelvic cavity is not separated, even though it appears to be on the lateral view. There's nothing that really separates the abdominal cavity from the pelvic cavity. They just do have them divided in terms of the organs that reside in those specific spaces because of their functions. As we mentioned before, the thoracic cavity has two pleural cavities that are lined with special membranes called serous membranes. These membranes produce serous fluid, which acts to lubricate and cushion the organs so they can move freely. When we look at the lungs, we see that the lungs have a layer of serous membrane that lies directly on the surface of the organ, the lung. This membrane has a special name. It is referred to as visceral pleura. Visceral means pertaining to the organ. When the visceral pleura folds back on itself to line the wall of the cavity where the lung resides, the name changes to parietal pleura. And serous fluid is found between those two layers. The word viscera means organ. So visceral pleura actually is found on the surface of the lung. Parietal means pertaining to the wall, and parietal pleura is the serous membrane that lines the wall of the cavity. It's really important that you understand the difference between these words and what they mean. The abdominopelvic or peritoneal cavity is also lined with serous membranes. By the way, the word peritoneal means pertaining to the stretchy stuff. We have yards of stretchy intestines. On organs within the abdominopelvic cavity, we have visceral peritoneum. That visceral peritoneum folds back on itself to form a second layer lining the wall of the abdominal pelvic cavity, which is the parietal peritoneum. The kidneys actually lie behind the peritoneal cavity and are considered retroperitoneal. Here's that term, retroperitoneal. That's why when little kids are in a dugout, the coaches don't like them to swing baseball bats. The kidneys are so close to the back and not well protected that they could easily be injured if struck with a baseball bat. Here again is a picture you can print out and practice naming the cavities. You should be able to do it on both the lateral view on the left and the anterior view on the right. Other body cavities include things like the oral and digestive cavities, the nasal cavity, the orbital cavity for your eyes, the middle ear cavities, the synovial cavities. Most joints in our body are synovial joints, and synovial joints have a capsule surrounding them and are filled with synovial fluid. This ends our Chapter 1 presentation. This is part 2 of 2. There are not 3.